Welcome to Joy in Our Town. I'm your host, Dave Wheatus, and today we're going to be talking about weight loss surgery. You know, weight loss surgery is becoming one of the most common alternatives for weight loss and helping people with weight loss. And my guest today is Dr. Tani Kabala. She is the author of a book called Weight Loss Surgery Coping Companion, and many doctors and other patients are using that book. And Tani, it's great to have you. Thank you for joining us.
Thank you for having me.
So in this first section, we're going to be talking about some of the physical and psychological issues as one prepares for this weight loss surgery. But then we'll be talking more in the second segment about the psychological aspects of after one has gone through that surgery. So why don't we start with this question: what is weight loss surgery?
Well, weight loss surgery is, as you said, the most common procedure right now for helping individuals lose weight who have not been able to do so just using diet and exercise alone. There are three primary types of weight loss surgery that are being used in the United States right now. They're gastric bypass surgery, the lap band surgery, and vertical sleeve. And all of these surgeries do one of two things, or a combination of the two. They either reduce the size of the stomach, or they change the way that food is digested so that less food is absorbed and thereby fewer calories are taken in.
Wow.
So in those two ways, weight loss occurs.
Right. So basically, they're when you say reducing the size of the stomach, some of the photos I've seen is where they're making a small little pouch.
A small pouch, exactly.
Whereas before our stomachs hold so much, now a person who has this kind of surgery can only have a little bit of food at a time.
Yeah, the pouch is often just the size of an egg. So it's only a very small amount of food that can be in the stomach at one time.
So tell me, why do some people elect to have this kind of surgery?
Well, from a physical perspective, I'd say the majority of people elect to have the surgery because their health is seriously at risk, either because of type 2 diabetes or very high cholesterol. They might have severe sleep apnea. They might have chronic joint pain from their weight, and their health is at risk, or there's even a life-threatening element to their health.
Okay, so it's not just for someone who is looking to lose 10 or 15 or 20 pounds.
Right.
It's someone who is at risk for serious health consequences because of their obesity.
Yeah, most surgeons have as a standard a body mass index of 40 or higher in order to have the surgery, or a body mass index of 35 or higher with some sort of serious physical health complication related to the obesity.
So to put that in layman's terms, because most of us don't know what a body mass index is, so somebody who has a body mass of 40.
I think generally speaking, it's a man who's about 100 pounds overweight or a woman who's about 80 pounds overweight.
So then the appropriate reasons for having this surgery is not simply to lose a little bit of weight.
Right.
And so it's a really extreme measure whereby someone wants to lose a lot of weight.
Or needs to lose a lot of weight because their health is at risk, or their life is at risk.
Right. So I'm thinking about some of the inappropriate reasons someone might seek to have this kind of surgery.
Right.
What would they be?
Well, as you say that, what comes to mind for me are the individuals who come to my office and say, I just want to be skinny because I think if I'm skinny, then I'll be happy.
Right.
It's kind of like what you might hear just in day-to-day life of someone who says, if I lose 5 pounds, I'll be happy. Or if I can lose the last 10 pounds, I'll be happy. Some people think that weight loss is just the key to happiness, and it's much more complicated than that.
Right.
So that's a little bit of a red flag for me when I hear that.
And when you get that red flag, what do?
Well, what I try to do is help them sort of manage their expectations, to give them a better sense of what the surgery is likely to entail for them physically and emotionally. And I help them wrap their mind around the idea that just losing weight doesn't mean the problems that you have before have suddenly vanished. If you've got difficult parents, you've still got difficult parents. If you have an abusive spouse, you've still got an abusive spouse. If you have low self-esteem, just losing weight usually doesn't suddenly magically give you high self-esteem. So it's the whole person is needs to be treated.
Right. And so I know that you spend much of your time treating the whole person.
Yes.
That you're not a surgeon.
Right.
You're a psychologist.
Yeah.
But nevertheless, you are familiar with a lot of these issues that arise with someone who's contemplating this surgery.
Yes.
So, so let's talk about some of the therapeutic steps. Somebody comes into you and they say, I'm interested, I'm a candidate for weight loss surgery. What do you do with them?
Well, the first thing I do is take a really thorough history of their relationship with food. Have they had an issue with food for their whole life? Have they been overweight their whole life? How was food and eating handled by the family? Were they shamed for overeating? Were they shamed for being overweight? Did they rebel against their parents by gaining weight because their parents put a premium on thinness? Like, what were the dynamics that were at work that led them to be overweight in the first place?
Okay.
So I try to help them understand what went on that led them to be overweight in the first place. So that's sort of the first step.
Okay. And I assume that helping someone understand some of these triggers is going to pay off in the long run.
Right.
Because the triggers aren't going to go away.
Exactly.
Yeah. So
Yes.
talk about some of the triggers for eating, because we all have them,
Right.
whether we're overweight or not.
Right.
Most of us overeat. Most of us eat for pleasure.
Right.
Right. Somebody will be at my table and they'll say, "I'm full. Are you still hungry?" And I say, "Well, what does that have to do with it?"
Right.
Right. I still want to eat because it tastes so good.
It tastes good.
Yeah.
Yeah, well, this really gets to the heart of weight loss surgery for me as a psychologist. What I find over and over and over again is that these patients have a long history of using food as a coping mechanism. They've been using food to escape, to self-soothe, and to have a sense of respite in a chaotic environment. So what I find are triggers related to anxiety. They feel anxious at school because the kids are picking on them, and so they hide and eat to soothe themselves. They feel anxiety because they don't feel accepted by their parents. They feel shame because they're not accepted by their parents, so they eat for comfort. Those are two that come to mind. They're lonely. Perhaps they're alienated from their peers, so they eat for comfort.
Right.
So those are some of the main ones that come to mind.
What about this issue of creating a layer on oneself, a layer of skin?
Protectiveness.
Protectiveness.
Yeah.
Talk a little bit about that.
Well, in my work with weight loss surgery patients, many of the women in particular share that they have a sexual abuse history. Perhaps they were sexually abused as a little girl. Then, in order to make themselves less sexual so that they're less likely to be hurt and violated again, they eat and they feel protected by their fat. And so they want to keep the fat. They want to keep eating because it provides them with safety. So for these women, a large part of them wants to have the weight loss surgery for physical and emotional reasons, but part of them is very scared to lose the weight because they're losing their protective shield.
And I would imagine too that that's a very unconscious kind of thing, right? So someone doesn't really necessarily know that they're doing that.
Right.
And so that's one of the things that you help them with.
Yeah, some know and some don't. You know, in time as we talk about what they've been through, it's sort of revealed that the overeating was a protective mechanism.
Hiding one's femininity, even, or I don't know if it plays the other way with masculinity as well. Right.
Yeah, I see fewer men, but I have had men come in and say, "I'm terrified to date. I'm terrified to just go on a first date to kiss someone for the first time, and if I keep this weight on me, I'm not going to have they think I'm not going to have opportunities, so this protects me."
Right.
Yeah.
So let's talk about some of the physical challenges to weight loss surgery.
Yeah.
Because I imagine this is something that you have to go in with your eyes wide open. So what are they?
Well, I mean, the first thing I would say is weight loss surgery is major abdominal surgery, and the recovery is tough. You know, it's hard to get around. There's pain. There's sort of disability for a period of a week or two. So just the initial recovery is tough, just like any surgery. But then beyond that, the one thing that comes to mind is because some of these surgeries sort of change the absorption process of food and nutrients, a lot of my patients have vitamin deficiencies. And so they have fatigue and headaches and just sort of this general malaise until they're able to get the nutrition, their nutrition sort of back on track.
Right.
So I encourage all weight loss surgery patients to work with a team, with me for the emotional elements, with a dietitian for the nutritional elements, with a support group for like the relational element, and of course with their surgeon. So
yeah, for the physical.
Yeah, like a team approach.
So this vitamin deficiency is not something I would have thought about, because I would think that people who have weight loss surgery would eat much more healthily, and then I know that's smaller quantities, but still it's a real issue for them.
Yeah, it's an absorption issue.
Okay.
Yeah.
Now, what are the dumps? You've mentioned that before with me.
The dreaded dumps. It's a syndrome that occurs when a weight loss surgery patient overeats, or if they eat a lot of a really fattening or dense food. Because the pouch is so small. Now the pouch is sort of overwhelmed. It's not, the food isn't being deposited into the small intestine as it should. And they experience flu-like symptoms.
Wow.
Severe vomiting, severe diarrhea, headaches, muscle aches. It's like a debilitating flu.
Wow.
So that's what weight loss surgery patients face if they go back to their old coping mechanism, which is overeating.
Right. And I imagine that is exactly what you start to work with them on, even before the surgery.
Yes.
Right?
Yes. As I said, my experience is that many of these patients have used overeating, binging as a coping mechanism. Now they've had the surgery, and that's not an option. So we have to work hard to find healthy, alternative, non-food related coping strategies
and that's
to avoid the dumps.
To avoid the dumps, and to really to manage those pre-op expectations.
Yes.
Yeah. What are some of the common myths to this type of weight loss surgery?
Well, there are a couple myths that come to mind. One we touched on earlier, which is if I get skinny, I'll be happy. And another myth is that I'm going to get skinny. Most weight loss surgery patients lose about 50 to 60% of their added or unhealthy weight.
Okay.
So most of them don't end up skinny.
I see.
They've lost weight, they're healthier, but getting skinny is a myth. So that's something that I try to educate patients on and manage the expectation of, the weight that you'll likely achieve.
Right. I guess as you're working with them, you can gauge as to whether they're getting that or not.
Yes.
Right?
Yes.
What do you do with someone who you can tell is just really not able to hear that and is really looking at this weight loss as a panacea for their life?
What I try to do with that is try to dig in and understand why they're so committed to getting skinny. What's driving that? Like why is that such a dream or such a goal? Who does that have to do with? What does that mean for them? And try to get to that deeper level.
Okay, that makes sense.
Yeah.